slated for the corner. We'll shift over one more lot, and we will build that villa there. I don't have a timeline or anything for that, but just want to keep you all in the loop. Now we're going to travel across the street to 414 Benjamin Drive. So Franklin Commons is located in a development right across the street from the rehab building. So when you drive by, you're going to see those duplexes and triplexes there. 414 Benjamin Drive came for sale, and Menno Haven purchased it. And our thought process here is that, we hear a lot about scale, and we need to increase our numbers in independent living. But many of us are aware of how much the cost of new construction is right now. So we're testing the waters to see if this unit here, because of the close proximity to our campus here at Brookview, it's literally right across the street from the rehab. There are 25 units in this little neighborhood here, a part of that larger development. So we're going to test the waters, and we're going to refurbish this unit to our standards and see if there are prospects out there that are looking for the peace of mind and security of coming to Menno Haven, but maybe just aren't quite ready to say, hey, I'm a part of a retirement community, right? They got 1 foot in and 1 foot out, so they don't technically live at Menno Haven, but you are. Again, this is a trial. I'm not sure what the future might hold there. We're going to give it a whirl and see if it's successful. As these units come for sale, we will see if that can be a part of our future process. I'll keep you posted. Okay? All right, so as Chaplain Lori mentioned, you're right. This town hall is about numbers, and I'm going to choke you with them. I got lots of numbers. Some of them we are going to talk about, and some of them we are not, right? We're not going to talk about polling numbers. We're not going to talk about any of those types of things. I joked earlier today that we probably have the highest viewer ratings for town hall because people know there won't be political ads when they watch the town hall. So I'm feeling a little under pressure. There's a lot of viewers out there. But I do want to dive in. I get lots of questions about lots of different numbers and lots of different areas here at Menno Haven. So I'm going to sling some numbers at you. Let's start with community nursing. So far this year, the community nurses have given 137 flu vaccines and 300 either COVID, RSV, or Pneumovax vaccines when we partnered with Walmart Pharmacy. It's a lot of shots. Some clinics, on average, we have our 25 residents that visit the hearing clinic each time they are here. And the podiatry clinic or the foot doctor clinic, when they come, it used to be monthly. It had to move to bi-monthly. The doctor's here twice a month now, and at each visit, there's an average of 25 residents that participate in those clinics. So I thought it intriguing to answer the question, what in the world do our community nurses do all day? Well, I can tell you that on an average month, they visit and take care of 40 wounds. They visit an average of 4 sick residents per week. They visit an additional 4 residents per week who had a fall. They visit an average of 8 additional residents per week who are either discharged home from the hospital or maybe needed to take a little vacation to the Menno Haven rehab or have a respite stay in a different level of care and have now returned home. Our community nurses follow up with them, and they average at least 15 calls per day. Some numbers from team services. That's the fancy word for HR around here. So far, our team services department has received 1,787 applications. We have hired 217 team members, bringing our head count to 664 people work here at Menno Haven. We've rehired 20 people. We have hired and sponsored 25 individuals to go through the CNA program. We have 17 mentors Those are team members who have identified, hey, I want to be a mentor to new team members that come along. They have specific training. They have increased responsibility. They get an increase in their salary for those additional responsibilities as well. We've put 115 people through CPR classes. We have terminated 196 team members. We have one team member who has over 45 years of experience, 8 team members with over 40 years of experience, 3 over 35, 8 over 30, 13 over 25, and 8 over 20, between 20 and 25. I joked this morning that I'm going to join the 20 club next year, and our friend Billy back there is going to join the 30 club next year. That's impressive. Yes. So speaking of retiring, we put some pictures and some names with some faces here. Some folks that have retired from Menno Haven this past year. Jeff Angle, everybody knows, one of our favorite security professionals. Suzanne Brown, Judy Bishop, Carol Keener, Helen Keckler, Maria Patterson. She just didn't work here a year and retired. She's been here at Menno Haven on and off for a while, but is finally retired. Doris Pinsky and Steve Vanza and Shani Wolf are people that we celebrated their retirement. So some changes in team services. I gave you this slide last time we were together at Town Hall and was talking about some of the differences in our team services department. And I'm happy to report that Kelly Iyer, who has been a team member here at Menno Haven, she actually started at Menno Haven as a culinary assistant at the Village Square. This is an amazing story. And she has held various roles and went back to school, got her LPN, continues to go to school now, and has raised her hand to be our talent acquisition specialist, aka recruiter. Oh, right? We love these fancy names, I know, right? So Kelly Iyer was our education and engagement coordinator, and she has transitioned to be the recruiter. So that opened up a position for our newest team member, Alika Benjamin Elliott, who is now our education and engagement coordinator. So you can see Alika's responsibilities are Relias, or our training platform. Because of the business that we are in, there are, if you haven't heard me say it, there's a lot of regulations. So there's a lot of regulatory requirements. Even in our culinary areas, there's regulatory requirements. And Alika will be managing that all for the entire organization. She will be managing the Inspire platform. That's the recognition program for our team members. She manages new employee orientation, the mentor program, and assists team services with all team member events. One of the past slides on the retirement, you would have saw that Steve Vanza has retired from Menno Haven. I want to introduce you to Cameron Daly. I have a sneaking suspicion Cameron might be back. He's not back in that little hidey room. All right. Well, it's Wes back there now. I embarrassed Cameron earlier today, so that's why he probably didn't show up. And I made him come out and wave. But this is Cameron. You will see him. He's our Director of Tech Ops now. So if you see him out and about, please make him feel welcome. All right. Let's talk about some more numbers. Did you know that in 1 year's time, Menno Haven Culinary will make 1,000 gallons of pizza and marinara sauce? We roast over 7,700 pounds of turkey breast. We serve over 12,000 pounds of bacon. We serve over 365,000 meals in our healthcare settings and personal care dining rooms. And we will handle over 223,000 transactions in our retail venues. Our Life Center Grill, Chestnut Landing, About Time Bistro. How about that? Here's some more fun facts. The treasure chest is projected to bring in $130,000 this year. On average, we volunteer and put in at least 2,000 volunteer hours per month. I can't do that math quick enough in my head. Our wellness classes will have over 300 pool classes and 1,347 land classes or group classes. In 2023, we provided 4,571 bus trips and transportation rides for our residents. So far this year, we're at 3,090. I have get lots of questions about our grounds department. So our grounds department at Chambers Point, we have 4 individuals. Dwayne is responsible for 29 cottages and the memory homes. Troy manages the manor, the Renaissance, the healthcare center, and the lake area. Garrett has 46 cottages, and Jason has 37. Come with me to Brookview. Carl has 24 villas, Dan 27, Ray 28. Bob, who's part-time, manages the grounds of our North Gate and some open common areas. Myron has 44 cottages, Charles 48, Todd 47, Joseph 43, Austin 9 cottages plus this building and the healthcare center, and Jeremy has the operations center, Village Square rehab, and the pond and park. Dog owners, he really appreciates you picking up after yourselves and your pets. So all in, ooh, ooh. I'm really thankful everybody picks up after themselves. So all in, the Menno Haven Grounds Department is responsible for over 200 acres. They coordinate power washing and coordinate all pest control and window washing as well. Not to be left out, our maintenance team. So the maintenance team is actually broken into 3 different departments: the refurbishment team, the life safety team, and the skilled trades team. So we employ 1 master plumber, 1 master electrician, 1 appliance technician, an HVAC technician, 2 carpenters, 6 painters, TV specialists, 5 preventative maintenance techs who are typically assigned to a building, 3 life safety techs, and most importantly, our locksmith and wall hole maker, Angie, the picture hanger. She's everyone's favorite, and 1 general maintenance technician. Year to date, the maintenance department has completed 23,691 work orders. As of today, they currently have 225 work orders open to complete, and that number continues to grow every day, right? So this isn't the list that just has to get done this year, right? Things just constantly keep getting added to it. All right? So I hope you enjoyed some of those numbers. So many of you in this room may have very likely completed an independent living survey. I want you to know that I read those surveys. The comments are important to me. So I want to share them with you. So I like to be transparent. I'm not just going to show you the good. I'm going to show you the comments that I'm calling not so awesome. I'm not saying that these are bad. These are just things that I'm a fixer. And I like to fix things immediately, and these might be some things that I'm just not capable of fixing as quick as what I want to or I'm able to, but I want to be transparent and share them with you. So these are things I'm calling not so awesome, or things that I can't fix immediately. And some of these comments were this: we need a dining venue at Chambers Point, but with no dining dollars. This is the first time I've seen this, so this was a shock when this comment came into me. So many non-Menno Haven people eating here in our dining venues, it's hard to get a reservation at Chestnut Landing. The Life Center Grill is disappointing. Training and supervision is needed. We need a lifeguard so we don't have to use a buddy system at the pool. Chambers Point needs a dedicated exercise room. The water pressure stinks, and it takes too long to get the hot water in kitchens. Maintenance doesn't call ahead before showing up for repairs. I feel like I need to do my own trimming of shrubs. Weeds, trimming, and mulch seem to be neglected in some areas. Grass on sidewalks after mowing. The grounds team are friendly, helpful, and pleasant, and perhaps short-handed. So I put this in the not so awesome because this impression that it was left by this individual that we do not have enough help. Communication tools like the portal TV channel need updating more frequently. New employees are not as diligent as those they replace. I hope that wasn't about me. And this last one has been especially hard for me and is one that keeps me up at night. Monthly service fees are escalating too fast, especially with the decline in quality services. And that, for me, with no context, I take personally. I don't know if the decline in quality services is based on food, care. I don't know. These surveys are anonymous, so I don't have any context to it, but it's these sentences that shake me to my core, that it is important to me and your leadership team that this rumbling does not go through, that we are okay with quality not living up to your expectations. And that is a hard thing to achieve because everybody's expectations might look and sound and see differently than the person beside you. But to me, what I want to really push back to you is that I want our culture here to be and continue to be an open door. If you come to any of my offices, there's glass in the doors. I want you to see if I'm in there, and I want you to feel comfortable come in. And if you feel like things are slipping, I want to talk about it and see if there's things that we can do to make it better. Because I'm happy that you're invested here at Menno Haven. Your happiness is important to me, as is the success of our team members. But I will not settle for the quality to decline. Okay? So some of the things that I'm doing to take action on some of these comments. Now, Ty is not here to defend herself because I made her literally yesterday take a selfie because she wasn't here yet. And I said, I need to put your picture up. And she's like, and I'm like, just put your camera in front of your face and take a picture. But I didn't tell her I was going to put it out for everybody to see. So Ty Beagle is going to be our Assistant Director of Culinary. Her roles are really going to be to come along and support everyone's fan favorite, Brian Lucas. And her focus is going to be the hospitality and supervision of the Life Center Grill, helping Brian with catering and support of our venues at Northgate. Ty had actually got her start here at Menno Haven as a Cura team member, and she started at Northgate. We then utilized her services through Cura at the Chambers Point Kitchen, the Manor, for several years. And she continued to be a Cura employee at different areas throughout the greater community. So her moment in time right this second is that she is jumping out of the Cura ship and coming back home to Menno Haven, which I'm really excited. And I think that, we are looking forward to the impact that she is going to have in the dining venues here. So I'm not trying to be a Debbie Downer. I have pages and pages of great comments as well. But like I said, we started with 100 slides and I need to pull it down to 70. So I won't inundate you with all of the wonderful comments that I got, but here's just a couple. The About Time Bistro, Cypress Cafe, and Chestnut Landing are wonderful. The staff at the Cypress Cafe are fully trained and make the experience enjoyable. Love the staff, love the chefs and the servers. Food is amazing. Food is delicious and varied. The culinary team are always courteous and anxious to please. The routine maintenance repairs are top-notch and the team is highly responsive. We love the window washing and snow removal. And the wellness team is engaged, helpful, and friendly. So when we do the math, 95% of the survey respondents report that they are extremely satisfied or very satisfied with Menno Haven. And that makes me happy, right? That makes me very happy. But that doesn't mean that we just sit back on those laurels. When there's things on your mind, we want to try to address them because we want to continue to have 95% of our respondents extremely happy. Okay. So I want to move in to some of the comments that we've heard from these surveys about our leisure activities and programs. You all should have received a notification from me about the changes that are happening to the leisure coordinator department here at Menno Haven. Some of the comments that I've received is there's a nice variety of trips, but communication could be better. Coordinators are patient and kind to those who need assistance. Point blank, this person felt like we need more. The trip program has deteriorated in quality within the past 2 years. Too many trips cost large amounts of money and too many trips for dinner only. We need more interesting trips, including historical sites and nature drives. And scheduling through the portal is frustrating. I concur. So I know that the notification and the change of personnel and the lack of, quite frankly, personnel in the leisure coordinator department has rocked a lot of people's worlds. And I want to acknowledge that. I hear it, I feel it, and I see it. And I meant what I said in the notification, that it is important to me that we reimagine this department. And reimagine doesn't necessarily mean that it's going to go away or that it's not a priority. It is a priority, but we need to figure out what is actually, or what does, or what should the leisure coordinator department look like and be like for the future. And I don't have the answer yet. But what I do want to assure everybody is that I'm asking for grace to take a heartbeat so that we can evaluate it. I'm asking that you keep the communication lines with us open between Billy, Tori, Denise, and myself. It's important, and I've got lots of emails. I've got lots of people coming up to me and saying, hey, what about this, and what about this? And keep it coming. The process here, somebody asked the question at our earlier town hall, well, how do we hire these leisure coordinator people? Well, they get hired by an interview process. Interviews typically start with the supervisor. This case, it would be Billy. If Billy thinks the person has a chance, they get to a second round with some more individuals. For this role, those individuals, we will also invite some residents to be a part of that interview process. I don't have all those details worked out yet. I don't think I'm going to be putting somebody in front of 200 people for an interview. They'll either sink or swim. But I'm not sure if that's fair. But I don't know how the package looks like yet. But I do know that we want it to be successful. And I mentioned at our earlier town hall that I put the leisure coordinators in that special box of unicorns, right? And I've talked to you before about our director of nursing. And director of nursings here at Menno Haven are required by the regulations to have in each of our healthcare settings. And director of nursings are responsible for clinical management and team member oversight, and they have to be really, really good at the nursing stuff and the regulations stuff. But they also have to be good people. And that sometimes is hard to find. Because if my strengths is very clinical and regulatory, sometimes maybe my strengths are not so good with the people. Or I'm really good with the people, this detail stuff I'll figure out. And what we ask of our directors of nursings are to be unicorns, to be excellent in both. Unicorns are out there. We just got to find them. I feel the same way about the leisure coordinators. They have to be fun. You got to want to hang out with them. They have to be creative. They have to come up with ideas. They have to be willing to communicate to you as the customer of what is it that you want to do. They also should come up with ideas on their own. So there's a flair there that's needed. But on top of that, they also have to be strong in what? Organization, communication, planning, detail. Unicorns, right? So even though I do not have all the answers, what I can say to you is this. We are not going to just hire somebody to hire somebody. A breathing body is not a unicorn. We are looking ahead through November and December. You should have received a flyer, but I'm going to put these up on the wall as well. These are the trips and events that we do need to cancel. But between Billy, Denise, and myself, all of the other events that are in the Connect are on. And we're going to make them happen. I've got lots of inquiries about tickets and things of that nature. If the event that you have tickets for and reservations for is not on this list, we are going. Okay? We're going to make it happen. Don't ask me about January. I got no clue about that. But we are just wanting to get through the next couple weeks. And I'm going to honestly say to you, for November and December, we probably will not be adding anything else that's not already on the books. Because we don't want to cancel, and we do feel bad about the things that we do have to cancel, but it's important to us that we keep moving forward. It will also give Billy, Denise, and myself some experience walking alongside all of you in this role as we prep and interview for who the future leisure coordinators may be. Okay? All right, moving on. I still got some more numbers. I want to talk just briefly about the Menno Haven Employee Appreciation Fund. I actually got, I get emotional every once in a while. It comes with my age. And last year I got emotional when I had team members reach out to me and they were emotional about the size of funds that they received from their Menno Haven Employee Appreciation Fund checks at Christmas time last year. So $194,829 was distributed. That averaged $318 for the eligible team members. And I just want to remind everybody there's still time to contribute. The cutoff is 11/22 this year. And those team members that are eligible for the Menno Haven Employee Appreciation Fund are team members who, and it's also based on hours worked. So leadership, directors, senior teams, we do not get that check. These monies need to be directly to frontline staff. And if I am a full-time individual that works here at Menno Haven, I'm going to have a bigger check than a team member who is just here maybe as needed or our PRN staff. Does that make sense? So it's based on hours worked as well. Okay. So we want to jump in a little bit and talk about the resident rate increases. My friend Ryan and my friend Denise are going to give you a little more information. The animal getting me. Coming up in a little bit. But we get lots of questions about how do we come up with this rate? Why does it differ in some cases to different areas? And the simple answer to that is this. It is important to us here at Menno Haven that we remain in the same ballpark with our competitors. And even though right here in the local Chambersburg area, we may not consider the other communities, the smaller life plan or CCRC communities or nursing homes, our direct competitors, but we are up against larger scale life plan communities out of the Lancaster, Frederick area. And if you shop those continuing care retirement communities, life plan communities, we are the best value for the dollar. And we need and want to remain the best value for the dollar, but we have to stay competitive and to be able to meet the expectations of you as our residents and future residents to come. So it is, I joked this morning that it would be very easy for me to take some cues from all the commercials that are on TV right now, and I could sling a bunch of promises that you'll never have another rate increase again. But that would be lies. But I want you to hear from me that this rate increase is something that we as a team, and most importantly the board, grapples over. And that it is important that we as a team and a board do everything possible to control our expenses. And I do not believe that I have any director or team member here that comes to work and says, today's the day I waste the residents' money. Right? That doesn't happen. However, we need to empower ourselves and our team members to focus on how can we save money. Are there practices and things that we do here that could be done better? And are we comfortable stepping out and challenging to try to control those expenses? And my answer to that is yes, and that's what we have to do. I might not be able to control the pounds of turkey and how much per pound the 7,700 pounds of turkey that we cook around here goes for. And there's things that I can't control. Ryan's going to talk to you about health insurance costs and liability insurance costs that I can't control, but I sure can shop it around to promise to get the best rate possible, because I know that those increases fall on your backs. And it's controlling and managing our wages and our salaries the best that we can. And so that is my promise to you. I cannot promise never to have another rate increase, but our forward-thinking functions have to be cost control. without losing sight of taking away amenities or taking away things that we can't afford. Okay? So with that, I'll ask Ryan to come up and continue to give us a little more information about finances. If you all need a stretch, you okay? All right.
Thank you, Tiffany. Good afternoon, everyone. It's great to see everybody here this afternoon. As I get started here, I just want to make a caveat to the numbers that I'm going to be reporting on. These numbers are year-to-date numbers through September 30th. We'll have October numbers here in about another week. So just wanted to give a timeline of what these numbers represent with it. But I'd like to start with the 2 required bond covenants to keep our creditors satisfied and happy. As we look at this, we can see that our debt service coverage ratio is at a 1.39. Our required minimum is 1.2, so we're well above the 1.2. Our days cash on hand remains strong at 342 days, with our required minimum at 150 days going forwards. Talk a little bit about the year-to-date performance. When we look at this, our operating revenue year-to-date is over by about $1.3 million. A lot of this is driven by the nursing area. With that, we've really put a lot of focus on census getting above budget from what we had budgeted, because revenue, we need it. And then if we look at our total expenses as we go forwards, this is one where we're unfavorable. We're unfavorable to budget by $2.3 million with it. So we're up 1.3 on revenue. We're over 2.3 on expenses with it. If we break that down, we know that our labor component is accounting for 1.9 million of that increase going forwards. And it's in wages, it's in health benefits. Medical insurance alone this year, we had budgeted almost 13-14%, and we're seeing closer to a $500,000 overreach. We are self-funded with this, and you are going to have those years. We have good years and bad years. If you go back and look at the last 3 years, it's been great. This is our bad year. But we know going forwards that it's anticipated in working with the insurance company that it's another 11.5% increase into 2025 as we go forwards. The other $400,000 that we're over is in other operating expenses. This comes from therapy with increased census, nursing. It comes from increased costs in culinary with increased meals that are served. It comes some in administration also. We've implemented a new HR system, which has now given us data that we need that communicates with our general ledger, and it's communicating with PCC as we go forward. So now we have systems in place that are communicating with one another. It has allowed us to actually look at different areas and just focus on that and see, what it means, revenue per resident day, labor per resident day. So we're able to break that down as we go forwards and actually dig in to see where can we cut costs going forwards. Because it doesn't work if you just say, hey, we got to cut 10% across the board. You've got to have a plan of where you can get that with it. But if we go on down the income statement as we're looking at it there, our non-operating revenue has done extremely well this year, and hopefully your own investments have done well with the market. We're favorable to budget $7 million, and of this, 3.9 million is in unrealized gains from the market. But if we go to the overall net decrease in assets, we're down $864,000, but this is favorable from what we had budgeted. We had budgeted to be about 6.8 million, so we're about 5.9 million favorable on that. This one here, as Tiff had alluded to, about the rate increases as we're looking at different things here. When we look at this, we can see that in 2023, our expenses was about $160,000 per day, about an 8.7%, if I remember right. I can't see the screen here with it. But with that being said, we know that when we're looking at the Consumer Price Index, or the CPI, that comes out monthly, and I don't know how many people here are looking forward to that every month, but it is something to look at every month. with it. But I'll just say, so far this year, year to date, we're up 5.7% over last year. So roughly $169,000 of expense per day here at Menno Haven with that. This graph will actually show the CPI for the last 12 months. And as we can see, we started January around the 3.1. I think we hit a 3.5 somewhere in about March. And it's slowly been coming down. And when we look at it for September, it's saying 2.4. I look at this, and a lot of times I'm like, this isn't the truth. And I know how they're measuring it, but it seems like when you go to the grocery store, you're not seeing these reductions in food. If you go out to eat, you're not seeing these reductions in the food. It does take time. From what I have observed in my own observation, it's 9 to 12 months before you really start to see stuff coming down with it. So if we remember, in 2023, we're at 8.7% increase. If we go back and look at the last 3 years of CPI, when we entered 2022, that was the highest year that we've seen. We were about 7.5% in January. In June or July, it peaked a little over 9%, and by the end of December, we were at about 6.5%. But when we look at our expenses for 22, it wasn't that high. It was like 4.8%. So that lag, we actually seen our increases in 23. So just like the CPI is saying, you know, we're coming down, we didn't come down enough yet. Now, I anticipate that our overall expense year to date, when we finish 2024, is probably going to be closer to 5%, because we do have some one-time expenses that come up throughout the year. And I'll just give you an example. You know, we just, the flu vaccine for team members, $30,000. It got expensed, you know, in the quarter, but we won't have that going forwards for the remainder of the year. You know, we finish up some audits and different things, whether it's our 990 benefit audit and different things. Those are paid, and we have no more going forward. So we're going to see a little bit of that reduction as we go forwards. But we've definitely seen, you know, last year an 8.7% increase, and this year probably another 5%. So, you know, the increase is about 13, 14% in expenses. I will tell you, as the leadership team, you know, is looking forward, you know, to this last quarter and then going into 2025, we are focused on expense monitoring and reductions, and have had some of those already in place, along with our revenue, making sure that we get census up and keeping the facilities full. Because sometimes you can't reduce staffing if you've got reduced census, just because of your staffing ratios with that. But going into 2025, we know we've got a couple of challenges. Healthcare is going up 11.5%, 12%. Our general liability insurance is going up about 14.5%. And that one, if you equated it to dollars, is about $85,000. That, you know, just by the insurance moving to the new year, you know, it's an increase of that kind of money. And we also anticipate that our food costs are going to go up about 4%. And again, that's working with culinary, that's looking at the CPI and what others in the industry is saying. Other expenses, as we look at 2025 and complete the 2025 budget, we're looking to keep wages no higher than 3%, to keep it below that, and other expenses anywhere from 2 to 3.5% as we go forwards with that. So, thank you. Up next is Billy.
Hello, everyone. Good afternoon. It's so nice to see everybody out here today on this lovely day and voting. I saw many of you at the poll this morning, so we were sharing pleasantries at the voting poll this morning. So I'm just here to give a couple updates on the auxiliary. First, I would just like to remind you, if you ordered a ham loaf through the auxiliary, one of our fundraisers, that those will be delivered next Thursday, the 14th. Down here at the lower level of the Life Center from 1 to 3 p.m. Just drive on through and we'll hand your ham loaf right in the car window to you. It's very simple. one good thing that COVID, when we had COVID, we had to reimagine things. And so that was one of the things we reimagined was just drive-through ham loaf pickup. Can't beat it. Also, let me make sure I get this the right way. Yay, I did it. Also, we currently have going on right now is the gift card sale. It's in your handout. So if you've misplaced yours and you would still like to order some gift cards through the Menno Haven Auxiliary, here's your order form. Thanks, Anna Mae. Great idea. This sale is going on till next Friday, the 15th. Again, there's many denominations of gift cards on the back, restaurants, shops, and various denominations. Those can be turned into any of the concierge desk at the Village Square, Northgate, Life Center, or Renaissance. You can pay cash or check payable to the Menno Haven Auxiliary. That we anticipate that those will come early December. We'll notify you when they are ready and get those delivered to you. Just a quick reminder that there are always gift cards available in the gift shops, that you don't have to wait till Christmas time to buy them, so we always have some on hand. And you see a little percentage number behind them. That is the small percentage that we get back from each gift card. It's hard to say each year how much we get back, but we do get a sizable percentage back from this gift card sale, so it's very, very nice and easy fundraiser to do. And then just a couple other things I would like to say. The auxiliary is winding down for the 2024 year. We have a meeting next week, the board, where we will be discussing projects for next year. We have team members and residents that submit information to me of things they would like to see funded, and so the board will meet next week to discuss those. So that's why it's important when you see the number Tiffany shared of the $130,000 that we're hoping that the treasure chest will make, that we can fund that dollar amount of projects back to Menno Haven. So we thank you, the board thanks you for the many ways that you support the auxiliary through the fundraisers, shopping at the gift shop, shopping at the treasure chest, bringing us your donations at the treasure chest so we can sell them. So just thank you in the many ways that you continue to support the auxiliary. Without you, we would not be able to do what we continue to do every year. So thank you. So Roger, come on down. I think you're the next contestant.
Thank you, Billy. Good afternoon, everyone. So I've got just a few things to share with you today. I know we spoke a little bit at a Coffee and Conversations, for those of you who aren't aware about the ongoing challenges between WellSpan and United Healthcare. They've both updated some things on their website that is, in essence, they have not been able to come to an amicable solution. So for those of you who have a United Healthcare Advantage plan or PPO, it's probably time to do some thinking about how you want to handle that. Again, I've been approached by several folks who have questions. I will reiterate, I am not a healthcare or a insurance professional, and so I don't really want to give advice on these things. But people have asked if they have a Medigap or a supplement through United Healthcare, will that still work? And I am 99% sure that yes, they do. They are really talking about the Advantage plans, but I would encourage you to check out the websites. This is a statement, and I know you can't read it, and I can't either, from WellSpan on their website. If you just Google WellSpan United Health, those are the first things that pop up. You know, there will be a link to the WellSpan site. There will be a link to the United Healthcare site. They each have their own spin on why they're, you know, not able to come to an amicable solution, but they haven't. So likewise, you'll see one on the United website as well. The negotiations are ongoing, but as of now, they are not in network. So people that have these plans, I think they'll still be able to see WellSpan physicians through the end of December, which, the open enrollment ends in December 7th, I believe. So if you are falling into that category and you have some questions, feel free to reach out to me. I'll probably tell you what I just told you. You better, check with your providers, check with your insurance company to make sure that you are still covered. Also, just a brief update. The CDC is always providing new guidance on vaccinations. And true to form, they just put out the other day a recommendation that for folks who have received the 24-25 COVID vaccine, like many of you have, that you should do it again in 6 months. So, I think we should just begin to expect to see that we're going to see, it's probably not going to be necessarily just a one-time thing every year, and that you may need to revaccinate for COVID every 6 months if you're so inclined. They're also recommending that for the pneumonia vaccines that are out there, they've decreased the recommendation from age 65 plus to age 50 plus. So for those of you who are over 50 but under 65, you might want to consider getting vaccinated for the pneumonia. Do have a couple updates about the Chambers Point Healthcare Center. Some news. The first news, I think, is that this is a unicorn. Michelle Mowry has joined us in the last couple months as the Director of Nursing at Chambers Point Healthcare Center. As Tiffany had pointed out, I know we've shared that over the past several years we've had some difficulty with keeping people in that role, and I think that we've probably got the right combination here with Michelle. She comes to us with 8 years of experience as a Director of Nursing. She is very well versed on the regulations, the standards of care, and how to achieve those standards. So we're really excited about that. She's also seems to be a genuinely nice person, and that's important. I think perhaps in the previous directors of nursing, we focused more on the genuinely nice person component and underestimated the demands and the challenges related to the regulatory environment that we live in today. So I believe we've got the right balance, and as I told the earlier group, I think there may be some providence involved, because during her second interview, she was actually wearing a blouse with a unicorn on it, and so that was my sign. And so if you get a chance to see Michelle, welcome her to the team. She's going to be a great addition there. Also, I'm really happy to announce that we're doing some, in my estimation, some really valuable renovations to the healthcare center. Some years ago we did create those country kitchens and added the activity center, in the to the general population areas. But what we really have not done much with in the past several years is changes to the actual resident rooms. And for those of you who have been into the new Brookview Healthcare Center, down at the rehab, to the memory homes, and even in our other personal care areas, those residents all have private living spaces. But within the Chambers Point Healthcare Center, we still have a predominance of semi-private rooms. And I don't know about you, but when I'm 85 or 95 years old, I don't necessarily want a roommate that I don't know well, right? And in many cases, that's what we're seeing. So we have taken the step that we are seeking through the Department of Health to reduce our overall bed capacity from 60 to 50, and we are going to take 10 semi-private rooms and convert them to private rooms. Along with that, we are going to do some, complete renovations of those rooms, all of the rooms in the healthcare centers, to upgrade the bathroom fixtures, to upgrade flooring, carpeting, the paint, and of course, as well as I've been here. I'm about to hit the 10-year club, but I don't believe that we've changed any of the furniture out of the healthcare center during the time that I've been here. So we are going to purchase some new armoires, dressers, and nightstands for all of those rooms. They did get some of the newer furniture when the old Brookview Healthcare Center shut down. They got some of their hand-me-downs, but we're going to get them the good stuff moving forward. So we're really excited about that, and we believe that that will enhance the quality of life for the residents at the healthcare centers. The last thing I wanted to share is many of you may know that November is National Alzheimer's Disease Awareness Month, and it has been, one of Menno Haven's strategic priorities is to really focus on working hard to become a center of excellence for Alzheimer's disease and other dementias. We certainly aren't there yet, but we are continually trying to push the envelope on new things to provide better care and services, to be a resource for the community, to be a resource to the caregivers for folks who live with these cognitive challenges. So Thursday, and this was in the Haven Connect as well, that we are hosting a Dementia Live experience right here in the event center. And Dementia Live experience is a simulation whereby people can kind of try to experience what some of the sensory challenges are for folks with Alzheimer's disease or other dementias. And there are still plenty of slots available. We're sending a lot of our staff through the training, but it's open to the public at large and to residents here of Menno Haven as well. There is a cost associated with this of $10 that goes to the nonprofit that's putting on the program. But there's still time to register. If you've got your phone out, you can snap that QR code, or you can go back to the Connect and find the website for Penn Cares and sign up. Dementia Friendly Pennsylvania is also another initiative, and Tiffany was talking about what are the community nurses doing these days, and one of the things that Sam Pence is doing is she is hosting several one-hour-long in-services for education for general public on some of the basics of what it is, Alzheimer's disease and other dementias. So again, I don't expect that you can probably read the dates and the locations for these, but there will be several opportunities throughout the month of November. There will be a video coming out with Tiffany and Sam here in the next little bit that will give you some more details. But if you are interested in attending one of those very informational one-hour sessions, contact Sam, either email her or reach her through the community nurses. And then the very last thing, I'm not going to tell you much about this. This is just a teaser. But you may have noticed an article that we put out on mild cognitive impairment in the last Connect, and there was this logo, and you are seeing it right. It is to whom I may concern, not to whom it may concern. But this is an exciting program that Menno Haven is going to begin to participate in, and you're going to learn a lot more details over the next few months as we work to set this up. But stay tuned. When you see that logo, read what you find, watch the videos, and I will turn this show over to Denise Ingram. Thank you all.
Hi, everyone. I finally learned to turn the microphone to my height.
So today I'm going to talk about some community highlights, updates. So good. Got the right slide here going. So I want to start with independent living availability. And so the marketing team sees availability a little different than residents do. The unit actually has to be released from the current resident back to the marketing department so that we can then remarket it to new people. So good news, this is information as of the 31st of October. Okay, so you can see Chambers Point Cottages, Villas, Northgate Apartments have 0 available for us to market as of the 31st of October. So everything has been contracted for or is occupied. Our Brookview Cottages, we have 3, 2 of which have garages, and we're working through our Now Club for our offers on those. Our Now Club is our Neighbors on the Way, so it's a paid wait list of people who have said, I'm coming to Menno Haven, I'm waiting for the perfect cottage, villa, or apartment. At Chambers Point, the Renaissance apartment building has 4 marketable apartments available today. 3 are 1-bedroom, and we have 1 2-bedroom apartment over there right now. In addition to that, we are strategic in refurbishing those. So we have 5 that we're working on right now, and we hope to have those finished mid to late January. And at that point, we're hopeful that we'll have an open house so you can see what we really have going on over there. But the last time we had to cancel that open house because every unit we had available that we had just refurbished had a name on it. So there was nothing to show because people were moving in. So that's all good news, right? So TIF's all about numbers. So we're going to talk about some other numbers. There we go. We're going to talk about marketing year to date. Now, previously I was able to see this entire, so I'm going to have to do this from memory right now. So currently, we have signed 40 brand new independent living contracts from the beginning of the year to now. We've had 32 external admissions to personal care or memory homes. Our admissions team has been extremely busy, filling 501 beds at the rehab center over the course of the past 10, 11 months. Our Brookview Healthcare Center had 118 admissions, and our Chambers Point Healthcare Center, we've done 67 admissions. So they've been very busy. For independent living, we have had 41 move-ins, plus we have 4 more. So by the end of the calendar year, we will have had 45 brand new resident, well, not really residents because some of those are twofers, but 45 units have been contracted for and have been moved into. We have today 7 new incoming independent living residents that will be moving in January or first couple weeks of February. So we have a very strong start to 2025, and we're really super excited about that. As far as activity, in addition to our active database, which is people who've already come in and checked us out, kicked the tires, done some tours, we have had 377 first-time inquiries for independent living year to date, and 172 personal care inquiries year to date. So the marketing admissions teams have been extremely busy, and we're extremely healthy. Now I want to talk a little bit about, a lot of times people are wanting to know what is happening with entrance fees. What goes into making an entrance fee? So a lot of times if you come through the marketing department, we always say the smaller the square footage, the smaller the entrance fee, and the more square feet that you have, the higher the entrance fee. Kind of makes sense, doesn't it? It's kind of like the real estate market. It's about location, location, location. So what are some of the changes between, you know, a Dahlia floor plan here versus a Dahlia floor plan there or any other floor plan? So location could be the actual physical place that it is, the privacy that's around that particular unit, the proximity it has to amenities, maybe green space is important, or if they're freestanding. So that goes into how we look and view how much is the entrance fee. We also look at the amenities and possible upgrades that are already part of the unit.
So after we've done the refurbishment, sometimes there's additional cabinetry, sometimes there's center islands, sometimes there's peninsulas built into the cabinets, so there's a little bit more cabinets in one unit than there is in another. So there's some dollars that we attach to that. Sometimes residents prior have done upgraded flooring. Some may have a screened-in porch, a deck, an extended patio, or sometimes a 3-season room. Those are all things that go into us thinking, how much should the entrance fee on this unit be? In some cases, there's limited availability for specific floor plans. I'm thinking right now of the Begonia floor plan over at Chambers Point. It's a very popular floor plan, has a 1-car garage, 2 bedrooms, and a lot of really nice privacy. You think about the Dahlia floor plan, and we have a lot of the Dahlia floor plan at Chambers Point, but we only have 16 units over here at Brookview. So that goes into that pricing model, as it should. Lower inventory versus higher pricing, right? And sometimes there's upgrades within the units. Some people may have chosen to add on a room. Some of those rooms are small, some of those rooms are large. Some of our units can have fireplaces, hardwood floors, maybe a 2-car garage versus a 1-car garage, or a no-car garage to a 1-car garage. Those are all things that have to go into thinking about what is the market value of our entrance fees. So those are things that we keep thinking about. The other question that we get asked is about monthly service fees. Sometimes we're at dinner with people who live in the exact same floor plan that we do, or right next door. And they say, well, I don't pay that. So I want to talk a little bit about what happens there. So prior to 2017, we call that the pre-2016 pricing on independent living contracts. Those were all set at 100 months. There were 100-month contracts that looked at a chart that said, what is the life expectancy of the resident coming in? At that point, they also all had a refundable portion, or what we call an interest-free loan. So a portion of the dollars that were invested in that entrance fee are going to come back. With that kind of contract in 2017, it was decided we were going to go with a different contract. So previous to 2017, it was 100 months of amortization. 2017 brought with it 49 months till your entrance fee was fully amortized. And you were also entering into the ability to have refundable portions where you pay a little bit more and you could go into a 50% or a little bit more and go into a 90% refundable portion. What we did with the monthly service fees, though, was we said anyone who came prior to 2017, we would grandfather you with the increases that we were having in monthly service fees based on what you were paying at that time, rather than moving you into a brand new contract model. So that's part of some of the changes that could be going across the table. The other thing that we also do, you saw earlier today that there are a lot of retirees that have been here a lot of years. And for that years of service, we have a retiree discount program that allows, if you've retired from Menno Haven for 10, 15, or 20 plus years, there's discounts on their entrance fee, and there's a discount for them to come in to a monthly service fee as well. So we wanted to reward them for their years of service with Menno Haven and hope that they love Menno Haven enough to actually live here. And I know we have at least one person who's doing that. And when the Northgate Apartments were originally launched, there were service packages that were attached to those monthly service fees as well, where the incoming resident could choose to add things like housekeeping, dining at that time, which looks very different than dining dollars today. So just that is some of the differences, that as you are having conversations with your neighbors, this is kind of, we're grandfathering people in and we're moving forward with intention. The last thing I want to talk about is the Manor First Floor project. Last meeting, we talked about the drop ceilings are all in place now. We have made selections on the carpeted surfaces for the hallways and for the dining room. There's new chairs in the dining room already. We've made selections for the bathrooms that are in the dining area and in the hall, so that we'll be getting new flooring, which has been selected. paint color, which has been selected, countertops, which have been selected, vinyl baseboard trim has been selected, and the handrails have been selected and are on order. We anticipate that the beginning of that project will be sometime after the first of the year, and more communication will be coming out about that. So we're really just down to what paint color do we really like for the hallways. But lots of things are happening over there. And with that, I'm going to turn it over to you, Chuck.
Good afternoon. You can see the screen, but I can't. But I can make that out a little bit back there. I got here about 5 minutes early, came in the back door, and I said, my goodness, this is a big crowd. I thought maybe it was a new movie premiere or something, but it's good to see you here. I've been involved here a lot of years, and there was one time that the residents didn't come to these, they didn't get involved. But we can only meet our potential as an organization if we interact with you. And Tiffany's been totally transparent, gives you the opportunity to learn about all we're doing. I even learn things myself. Then you get to ask questions. So development plays a major part, and then we meet with finance. We just did the budget. What do you need? Because we've got to fill in the holes. We can't do everything with our operating income, and we want to keep your fees as low as possible. And like the project we're doing at Chambers Point, the first floor there, that was totally funded by contributions, about $235,000. So just to give you a little history there. Oh, pressing the wrong button as usual. There we go. And as I was just saying, you're making a difference. Everything we do is to make a difference in your lives. Now that's hard to see, but I wrote it, ought to know it. Benevolence is a major part of my job in fundraising. You know, you can be guaranteed that if you run out of finances, you're not going to be put out because of that. Since the day they opened here in '64, it's been that way, because it was opened not only to care for people, to take care of people who might not have the resources. Our goal this year is about half what we spend. It's about $750, but each year we'll try to work up that. We're at $705 now, and we haven't even really, our mailing doesn't go out for 2 weeks for year end, and as you would guess, most people give at the end of the year for a lot of reasons, so we're looking forward to that. Habitat, you all know about the Hope House. That has been a very exciting and an interesting challenge. But as you can see here, we have a goal of 250. We need about 190 yet, but we have a lot of things coming in. Contractors work out there, and they give us an in-kind donation of their work. We never know what it's going to be. Sometimes it's a little, sometimes it's a lot. And luckily we're going into 2 tax years. It won't be done till April. And if you see the picture down there, I hope it's not too little because it looks awful little to me way back there, but you see that young lady out there. That's our CEO, Tiffany. And when I saw that, I thought, that looks like a little girl whose friends had left and her mother said, get outside and pick up those toys they left there. So, and she looks like she's doing a good job. You see her here with Wayne Yeager, who was our past chair, and of course, he's had a lot of experience in building. Now, one thing we need are volunteers. Now, I know some of you can't do it physically. I'm going to do some things a little bit lighter. I got 2 torn rotator cuffs, so I can't do a lot. But we've had 25 to 30 volunteers, and we're looking for more. For those that need a little bit lighter job, we're going to be bringing in all the doors, the woodwork, and We're putting it in a cottage here. I don't know where it's at, but we'll let you know. And we'll set it up so you're able to paint those. You can be part of this, and we'll keep you in touch with that. Branch Creek, we just started this year to raise some dollars. We've never done it before. That is our community outreach. We run the community program there. About 225 residents of that area are members, and it's quite an experience. I know we're going down soon, senior management for Thanksgiving, and we'll serve them Thanksgiving lunch. And to hear the comments is unbelievable. So anyway, we hope in the next year, we want to get you down there. You got to be familiar with it. You got to know what it is to donate, and we're going to get you there. Okay, Menno Cares. That's like the employee fund, the appreciation fund, but this one is tax deductible. I'll get to the employee appreciation in a minute. And we buy things like we're getting ready to give turkeys or hams out to all employees here for Thanksgiving. If someone can't, there's a lot of people out there who have a lot of need. Out of our 650 employees, I would guess 75% of them are living from paycheck to paycheck, probably like most of America. But they might need help paying their electric bill, car payment, whatever it may be, or there may have been a tragedy. We help them. Someone may have passed. And it just came to my mind, but if you ever know of anyone that someone passes and they don't have the resources, we have about 22, 23 cemetery plots that people have donated, and we donate them to basically anyone in the community that would need one. You see all these projects, these are some of the things that you have funded. We did the golf carts. It was a lot of fun. We have 2 now. We're getting them wrapped this week with the Menhaven logo. And you want food, just call and they'll deliver it to you on both campuses. We've got a number of vehicles. Either someone gave us some money to purchase it for maintenance. Someone gave us one for home care. We're always needing vehicles. And then we have the gazebo that was donated by a resident, a young lady, that she was out walking on the trail up here. And I might have told you this before. She said, I can hardly wait till I get to that gazebo. Well, that thing was about ready to fall apart. And we had it taped off. She couldn't sit down. So she called me and says, Chuck, what's it going to take to get a new one? I said, $10,000. She said, I'll bring you a check tomorrow. I said, I'll be here. And, and she did. But that's, I mean, it's such a giving community. We're truly a philanthropic community. Now, this may not concern you unless you're from Chambers Point or you go over there. Remember, we're really one community. I know we talk sometimes that Route 11 is the Grand Canyon. You know, you can't get people across it, but it's not. And we have a resident who's totally funding. We're just going to gut it a whole, it's pretty dilapidated, new salon there. And things are expensive these days. They need 2 sinks that go up and down, and for people that are handicapped, they can't wash their hair or anything. You know, those sinks are $6,000 a piece. So, and we're trying to keep costs down. Why? We thought we'd get it done earlier. We'll get it done in January because we're trying to get our maintenance people who are carpenters and do the projects, Jim and his gang, to do this. But they've been so busy doing other things. But they'll be getting to that because if we would contract that outside, unbelievable what the price would be. And Giving Tuesday, this is nationwide, and I thought I'd just throw it in kind of to remind you, year-end giving. Check with your financial advisor, your tax accountant. You know, the minimum required distribution from your IRA. We get a lot of people do that. Comes directly to us, it has to. You don't show the income, you don't get a deduction. Great way to give because it doesn't put your adjusted gross income up. And if you don't break the standard deduction, you won't be able to deduct it. You get the best of both worlds here. Securities, everyone's bound to have appreciation. If you don't, get a new investment advisor. Because there's a lot of gains. Now, I don't know if they'll be there tomorrow, but great way to get a real tax relief. Okay, dog park. Everybody knows I love dogs, and that dog park has just someone down there all the time. At 4 o'clock, they have a big party every day in nice weather. Guess we'll have one today. So, but if you would somehow, when we got the applications, they were found in each person's file, resident. I'd like to know, I thought there'd be a list. Well, there's 1,200 files. I'm not going to look through them all. And we really should get them updated on the portal, resident portal. You can get one there. You can stop in and see Allie or I, or into the marketing area and get one. That will really help us, and we appreciate it. And also, we're planning on raising some funds. I already have people giving some money to put a nice gazebo down there. So the dog owners will be able to sit under it and not get wet. Their dogs may, but they won't. So this is the employee fund. I've been doing a lot of research this year. We're hoping that we can get it tax deductible next year. This was established by residents years ago, and they didn't get a 501c3. We do all the work, but it can't be tax deductible. So we're looking at about bringing it under ours, under development. And if I can, I will, and I'll let you know the first of the year. And we think that'll increase giving. Okay, I can't read all these, but you know, the chaplaincy or pastoral service comes under development. This helps because if I can't meet my goal, I call them and chaplains pray. We always meet our goal. So that helps. But we have a lot of things coming over the holidays. I really enjoy all of them. We have the one where we're collecting food, the chaplains. At each facility, there'll be a table that you can put food on, and that goes to Branch Creek. They have about 225 members there, and a lot of them need help. Great way to help someone else. And we have the Christmas tree lightings. Always love those. One at Chambers Point and one here at Northgate. Well, you can probably see the rest better than I can. But they'll be coming out in all our communication venues. Keep your eyes open or call me, and I'll figure it out. But this is time of season for everyone to get together. Okay, finish up here. The Christmas jar. I'm not going to tell you a lot about it. But you know, at Menno, every day something happens special. My position is not boring. And most of them are very positive. This happened a few years ago with a resident, and it has to do with the Christmas jar. And I want to tell you about it. We're putting out our newsletter in the next 2 weeks, and my article, I got to write it, but it'll be on the Christmas jar. And if that don't inspire you, I don't know what will. And just remember, go through the whole newsletter. It's our year-end mailing, because there just happens, I don't know how it got in there, an envelope at the back. And feel free, if you want, to fill it up. But a lot of great things happen here. And development wants to wish you all a joyous, peaceful, happy, and joyous new year, and worship the birth of Christ. Thank you.
Well, you survived. You survived. This is a moment that we open it up for any questions, comments, concerns, or demands. I see we